In this video, we'll discuss cognitive therapy. So cognitive therapy was developed by Aaron Beck in the 1960s. So it's based on the idea that how you think determines how you feel and act. Cognitive therapy is going to focus on how thoughts lead to feelings of distress. It suggests that emotional reactions are the result of your thoughts about the situation rather than the situation itself, and it encourages clients to find more logical ways of interpreting situations and create positive ways of thinking. So cognitive therapy is going to focus on the thoughts and how those thoughts lead to our emotions, and then those emotions cause us to have certain behaviors, and that there's an interaction between the thoughts and the behaviors, the thoughts, the emotions, and the emotions and the behaviors. So we want to change the thoughts we want to change our thoughts so that we have different emotions and in turn different behaviors. So in cognitive therapy, first the therapist is going to help the clients become aware of their cognitive distortions, their thinking errors. So here are some examples. Overgeneralizing, taking a small situation and making it a huge situation. Being polarized, black or white thinking, seeing things in absolutes. I'm either perfect or I'm a failure. And so that's a common thinking error that we see in depression or in individuals with depression. Jumping to conclusions, so assuming that people are thinking negatively about you or reacting negatively to you without any evidence. So once the client's aware of their cognitive distortions, then we want to change that dysfunctional thinking pattern by challenging irrational beliefs, focusing on the illogical basis of them, and correcting them with more logical and rational thoughts and beliefs. So here's just an example. An individual failed a test. So if an internal belief is I'm worthless and I'm stupid, as a result, depression could result, or it could signify depression. However, if the internal thought is I'm smart, but I didn't study for this test, I didn't try my hardest, things got in the way, I can do better, then no depression results. So unlike other forms of psychotherapy, cognitive behavioral therapy focuses more on the present issues rather than on the patient's past. Rational emotive therapy was one of the first forms of cognitive behavioral therapy that was founded by Albert Ellis. And cognitive behavioral therapy, CBT, which is commonly used, works to change cognitive distortions and self-defeating behaviors. In other words, it works to change how people think and how they act. The goal is to help clients examine how their thoughts affect their behavior. It's a combination of cognitive therapy and behavior therapy. It uses the ABC model to reveal cognitive distortions. The A, or the action, is the activating event. The B is the belief about the event. And the C is the consequences of the belief.